Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. Je passe la parole au ministre Dominic LeBlanc.
Alors, merci beaucoup, Corinne. Bonjour tout le monde. Good afternoon. Today I'm joined by my colleague, Minister Anita Anand. Il n'y a pas de plus grande priorité pour le Canada en ce moment que de combattre et de vaincre la COVID-19. La COVID-19 a eu une incidence profonde sur la santé et la vie sociale et économique de tous les Canadiens. Yesterday, the Deputy Prime Minister announced an additional $7.2 billion in support for urgent healthcare needs across the country, the COVID-19 vaccine rollout, and for local infrastructure projects in cities and communities across the country. Our government committed to supporting Canadians during the pandemic, and that is exactly what we are doing. We will continue to always work collaboratively with provinces and territories to ensure that together Canadians get through this difficult pandemic. I would now like to invite my colleague, Anita Anand, to say a few words. Anita.
Thank you so much, Dom. Good afternoon, and thank you for joining us today. I have a brief update on the deliveries of vaccines to Canada. Since negotiating the early deliveries of vaccines in December, Canada has now received more than 6 million doses of vaccines to date. In fact, Canada's shipments of vaccines over the course of the next 3 months are expected to match the total number of doses received over the course of the past 3 months combined. That is 6 million more doses coming to Canada between now and April 18th. Les livraisons de vaccins au Canada au cours des 3 prochaines semaines sont en voie de correspondre au nombre total de doses reçues au cours des 3 derniers mois combinés, soit 6 millions de doses supplémentaires d'ici le 18 avril. Included in the doses that I just mentioned are the 1.5 million AstraZeneca doses from the United States that I can now confirm will arrive in Canada this coming Tuesday by truck. We have said from the beginning that the first quarter of this year would represent a period of increasing supply as vaccine manufacturers ramped up production, and this would be followed by significant supplies coming to Canada. We are now seeing that supply surge, and it is set to continue. Pfizer is providing at least 1 million doses a week from now until the end of May. Moderna is increasing the frequency of its deliveries from every third week to every second week, with 855,000 doses shipping the week of April 5th and 1.2 million doses shipping the week of April 19th. That is 6 million doses from Moderna and Pfizer alone in the month of April. Nous voyons maintenant une forte augmentation de l'offre et qui devrait se poursuivre. Pfizer fournit au moins 1 million de doses par semaine d'ici au mois fin mai. Moderna augmente la fréquence de ses livraisons de toutes les 3 semaines à toutes les 2 semaines. In speaking with Moderna executives yesterday, they assured me that their second shipment will come a few days later than expected due to temporary circumstances relating to the quality assurance process. As mentioned, we remain on track to receive 855,000 more doses from the company the week after next as scheduled. At the same time, as manufacturers stabilize their production lines, we are closely monitoring the global environment, including export restrictions in a number of jurisdictions. Our officials across numerous departments, as well as our suppliers, are working ahead of time to ensure that Canada's vaccines continue to arrive in our country. Not only have all the necessary export permits been secured for next week's shipments, but Pfizer has already received the necessary approvals for the shipments taking place the week of April 5th. Beyond seeing these doses coming to Canada, they also are being administered at increasing rates. Yesterday alone, 190,000 Canadians received a vaccine dose. 11% of the Canadian population has received at least one dose so far. Given the profound period of global demand for vaccine, there will continue to be bumps along the way, and we will continue to work every day to ensure that vaccines arrive in this country. As we have seen, these bumps are temporary and have not knocked us off course. And as I mentioned earlier, during the next 3 weeks, Canada is scheduled to receive the same number of doses that we have received over the course of the last 3 months. And this schedule will continue to accelerate. Indeed, my work every day is to bring as many doses of vaccine into Canada as early as possible. This is exactly what my team and I will continue to do until all Canadians who wish to be vaccinated have access to a vaccine. Thank you. Merci. Megwetch.
Merci beaucoup, Anita. So, Corinne, we're happy to take questions now.
Merci. Nous allons donc passer à la période de questions. Toutes les questions aujourd'hui sont au téléphone. À titre de rappel, on vous demande de vous limiter à une question et une question de suivi chacun. We will now take questions. All questions today are on the phone. As a reminder, we ask that you limit yourself to one question and one follow-up question. Nous allons donc prendre la première question. Opérateur, c'est à vous.
Thank you. Merci. La première question, l'inaudible. À vous.
Oui, bonjour, Monsieur Leblanc. La question va être à vous, puisque c'est vous qui êtes là. Il y a le syndicat des agents des services frontaliers qui rapporte aujourd'hui que dans les 2 derniers jours, 8000 personnes ont traversé la frontière terrestre pour la Pâque juive. Pouvez-vous nous dire qui surveille cette situation? Est-ce qu'on ne laisse entrer que des citoyens canadiens testés avec un plan de quarantaine? Et qui nous assure qu'il n'y arrivera pas un problème avec cette entrée massive?
Comme vous savez, depuis le début de la pandémie, le gouvernement a mis en place une série de mesures restrictives précisément pour protéger la santé des Canadiens. À plusieurs moments, nous avons ajouté d'autres couches de protection, de mesures additionnelles basées évidemment sur les avis des médecins, des scientifiques, que les gens se présentent au poste frontalier terrestre. Il faut, comme vous le savez bien, il faut qu'ils aient un test de dépistage négatif à l'intérieur de 3 jours avant leur arrivée et ils sont évidemment sujets à d'autres mesures de tests de dépistage à leur arrivée et des mesures de quarantaine. S'il y a une augmentation de volume de Canadiens qui veulent retourner, par exemple, comme vous savez très bien, la loi ne nous permet pas, évidemment, de retourner un Canadien qui se présente ou une Canadienne qui se présente à un poste de frontalière terrestre. Mais nous allons nous assurer que toutes les mesures nécessaires demeurent en place, ne sont pas changées pour s'assurer de la protection de la santé de tous les Canadiens.
Alors, est-ce que vous pouvez assurer que ces 8000 personnes dont on parle, ce sont tous des citoyens canadiens qu'on ne pouvait donc pas retourner? Et Madame Anand, je ne sais pas si vous avez un update à nous donner sur le vaccin Johnson & Johnson et qu'est-ce qui retarde le fait qu'on n'a toujours pas de date de livraison?
Alors, Lina, moi, je parlerai un peu de la question des agents frontaliers et Mme Anand pourra répondre à la question des vaccins. Les règles n'ont pas changé. Il n'y a pas de tourisme qui est permis aux frontières avec les États-Unis. Ce n'est pas des Américains qui décident de venir en vacances pour une fin de semaine au Québec ou au Canada. Les frontières demeurent fermées aux touristes. C'est des travailleurs essentiels et les Canadiens ou des résidents permanents qui arrivent au poste frontalier. Ceci n'a pas changé. Alors, il n'y a pas eu de changement des règles. Si des Canadiens décident de retourner pour une raison ou une autre ou de traverser la frontière, ils seront sujets à toutes les mesures nécessaires depuis plusieurs semaines, plusieurs mois, afin de s'assurer la protection de la santé des Canadiens. Alors, il n'y a pas eu de changement, d'allègement des obligations au poste frontalier et nous allons pas changer non plus ces mesures-là dans les prochaines semaines.
Merci. Prochaine question. Oh, no, sorry, Minister Nunn.
Un moment. Oui, oui. Merci beaucoup pour la question. J'ai récemment parlé avec le fournisseur Johnson Johnson afin de faire pression pour obtenir un calendrier de livraison. Nous fournirons ces informations dès que nous les aurons, car nous comprenons qu'il faut du temps pour planifier l'intégration d'un quatrième vaccin dans les programmes de vaccination des provinces. Nous allons vous donner l'information quand nous aurons l'information. Merci beaucoup.
Merci. Donc, nous allons passer à la prochaine question. Opérateur, c'est à vous.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good afternoon, Minister. I'm wondering about the Moderna delays. I know you said last night that has nothing to do with the EU export restrictions. I'm just wondering if you can go into any more detail about the assurances you received from the EU that they're not targeting us when they target to reduce shipments.
Well, thank you so much. On the subject of Moderna, I specifically raised the issue relating to the EU with the supplier yesterday, and Moderna confirmed that the delay of a few days is not related to EU restrictions. They have had those doses already cleared to come to Canada, and they will be arriving next week. And in terms of the EU itself, we're continuing to speak with our suppliers as well as our ambassadors. As you know, the Prime Minister also spoke with Ursula von der Leyen to express the importance of continuing to receive Canada's doses. That is doses that we have contracted for already into Canada. And as you can see, Ryan, the proof is in the pudding. We're receiving 3.2 million more doses next week and 6 million doses between now and the 18th of April. Thank you.
Yeah, just as a follow-up, I'm wondering if you sort of advised the provinces, obviously this delay hit this week. I know it's short term, but, there's vaccine nationalism, there's production delays, there's all kinds of things that can go wrong when it comes to deliveries. Have you advised provinces to expect this rollout to be bumpy at times, to see ups and downs from week to week, even if there's sort of a steady flow of vaccines?
Well, I will respond and then I'll ask my colleague Dom LeBlanc also to respond since he is the Intergovernmental Affairs Minister and speaks regularly with the provinces. But the reality, Ryan, is that this is a period of intense global demand for the same product. And as a result, what we have seen the worldwide is that countries are competing for vaccines. In this process, Canada is utilizing its diversified portfolio of vaccines to pull vaccine from multiple sources: Belgium, Spain and Switzerland, India, the United States. That's part of our strategy of diversification in order to manage the bumps that the international environment is presenting to us. We are working every single day to ensure that the vaccine doses for which we have contracted continue to arrive into this country, and that's exactly what you're seeing, the acceleration of doses from Q2 to Q1. We will end next week with 9.5 million doses in this country. 36.5 million doses prior to the end of June and 118 million doses prior to the end of September because of the aggressive approach that we are taking every single day, staying on top of this file and managing the bumps along the way. Dom?
Thank you, Anita. And perhaps I could also add our daily contact with provincial authorities around vaccine logistics, around the rollout and the ramp up, as Anita said, for the increasing number of millions of doses that will arrive in Canada over the next few weeks. This is an ongoing, active conversation daily. General Fortin and his team at the Public Health Agency of Canada have regular and ongoing planning meetings with provincial authorities. We recognize that as some of these inevitable ebbs and flows in terms of weekly deliveries occur, it's important for the provinces, as best as is possible, to have the latest information, to have visibility on when and how many doses will arrive in Canada so they can plan, obviously, the most effective and efficient rollout. So this is a very positive and ongoing collaboration. Obviously, when we receive news of changes or adjustments that are typical and that we had said would be an inevitable part of this global ramp up. As we receive that information, we immediately, obviously, pass it along to the provinces and work with them so they can do the most effective planning possible. And our information and our experience has been to date that the provinces are well prepared, are effective, have a series of redundancies in terms of their own ramp-up plans. So we're very confident that this will all go very well.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Prochaine question. Julie-Anne Lapointe, Radio-Canada. À vous.
Oui, bonjour. Il y a l'Agence de la santé publique qui dit aujourd'hui que c'est vraiment une course entre les variants et les vaccins qu'on voit en ce moment, mais on n'est pas à l'abri des imprévus, là, nécessairement. Vous appelez ça des bumps dans la livraison des vaccins. Comment alors on peut rassurer la population que la vaccination va l'emporter sur les variants?
Peut-être, moi je pourrais débuter si Anita veut ajouter quelque chose. Juliane, comme nous avons dit depuis le début, l'aspect global de l'approvisionnement des vaccins nécessairement va amener des ajustements d'une semaine à une autre semaine. C'est le cas pour tous les pays au monde, comme Anita a bien dit, qui cherchent évidemment les mêmes vaccins et sur une base prioritaire. C'est la raison principale pourquoi le Canada, comme nous avons dit très souvent, a décidé délibérément, basé sur l'avis des scientifiques, des médecins, d'avoir une portefeuille diversifiée, qu'on ne soit pas dépendant d'un pays, d'une compagnie, d'un contrat pour pouvoir vacciner le plus grand nombre de Canadiens le plus vite possible. C'est l'objectif de notre gouvernement. C'est un objectif qui est partagé, évidemment, avec les gouvernements provinciaux. La Dr Tam et les autres responsables de la santé publique dans les provinces ont souvent dit que le plus vite qu'on peut vacciner les Canadiens et le plus grand nombre de Canadiens qui acceptent de se faire vacciner, le plus facile, ce sera de maîtriser l'arrivée des variants. Alors, encore là, cela n'a pas changé. On fait, je pense, assez bien en termes d'avoir des vaccins le plus vite possible au Canada. Et les autorités provinciales font très bien à les administrer le plus vite possible aussi. Et nous n'allons pas arrêter jusqu'au moment où tous les Canadiens qui voudront être vaccinés ont eu la chance d'être vaccinés. Peut-être, Anita, vous voulez ajouter quelque chose? Ou...
Oui, merci beaucoup, Dom, et merci pour la question aussi. Premièrement, Dom est correct. Nous avons renforcé la résilience des chaînes d'approvisionnement en vaccins du Canada grâce à la diversification. Avec plus d'un fournisseur livrant au Canada, nous sommes en mesure de garder le cap malgré les turbulences. Bien qu'il y a toujours de la volatilité dans les chaînes d'approvisionnement mondial, les vaccins continuent d'arriver au Canada. Depuis cette semaine, comme j'ai déjà dit, le Canada a distribué plus de 6 millions de vaccins dans tout le pays et plus de 3,2 millions de doses supplémentaires devraient arriver la semaine prochaine. Donc ça, c'est notre progrès, mais ça, c'est aussi notre travail. Et chaque jour, nous travaillons sur cet dossier pour s'assurer tous les Canadiens que les vaccins vont continuer d'arriver ici.
En suivi?
Oui, peut-être un suivi davantage pour le ministre LeBlanc. Votre région, l'Atlantique, est citée encore une fois aujourd'hui pour sa façon d'avoir répondu à la hausse du nombre de cas de variants. Comment vous expliquez qu'ailleurs, les cas de variants sont préoccupants? Est-ce que les provinces en font assez, d'après vous? Est-ce que vous êtes d'accord qu'il ne faut pas relâcher les mesures, comme le dit l'Agence de la santé publique?
Moi, je pense, si on parle de ma province, par exemple, au Nouveau-Brunswick, moi, je pense on a eu un succès important à maîtriser l'arrivée des variants, à essayer de restreindre le nombre de cas de COVID. Et ça, c'est vrai pour toutes les provinces de l'Atlantique. Alors, moi, j'ai pleine confiance dans les médecins, les autorités de santé publique provinciales pour leurs décisions. J'ai vu, par exemple, le nord-ouest du Nouveau-Brunswick, ils ont changé le niveau d'alerte à cause d'une inquiétude possible de variants. On a vu à Terre-Neuve, par exemple, qu'est-ce que l'arrivée d'un variant peut faire en termes d'augmenter rapidement le nombre de cas, mais on a aussi vu un succès très important des autorités terre-neuviennes en termes de maîtriser la situation. Alors moi, je suis tout à fait confiant, pour répondre à votre question, je suis tout à fait confiant que les autorités provinciales à travers le pays ont tout ce qu'il faut pour prendre les meilleures décisions afin de protéger leur population.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Next question, Glenn McGregor, CTV News. Your line is open.
Thank you. Minister Anand, despite what you've said about exports from Europe, it still is uncertain in the future. And can you tell me what kind of conversations you've had with Pfizer or Moderna about that possibility that exports would be restricted from Europe, what they would do in that case to fulfill their contractual obligations to Canada? Is there any possibility that it could be directed from somewhere else? Is there a possibility of supply coming from the U.S. directly?
Well, thank you so much. And Glenn, you're exactly right that this is an issue that we're watching very closely, as we must and as we should, given that there are new developments in the EU. Having said that, we are directly engaged with our suppliers to, first of all, ensure that our doses are ready to leave Europe. They're clearing the export control restrictions that Europe has set in place to enable them to leave Europe. And that's exactly what we have been able to manage with our suppliers. The doses have continued to arrive since January when the discussion of European restrictions began. And indeed, going forward, we've been assured that the doses have been cleared to leave Europe for next week and the week after. But again, it is a situation that we have to watch very closely given the intense global competition for vaccines. And as you suggested in your question, all options are on the table at this point. You have seen us, in the case of AstraZeneca, for example, pull that vaccine from multiple locations, from the Serum Institute, from this deal with the United States government, from our bilateral arrangement, from COVAX. We are diversifying all of our options at this point to make sure that we are going to continually receive vaccines into Canada from approved suppliers. And that is the work, as I said, that I do every single day and will keep doing until we have sufficient vaccines in this country.
We haven't heard a lot in the last couple of weeks about Johnson & Johnson, and could you give us an update on where discussions are about supply, when, how many doses could be expected, and when they would arrive, and whether or not they would be in any way impacted by European export controls as well?
Well, thank you for the question. And I have repeatedly stressed to J&J the importance and necessity of Canada receiving a delivery schedule as soon as possible. We are set to receive J&J doses in the second quarter and the third quarter of 2021. We are in total going to be receiving 10 million doses of the single shot vaccine. The precise delivery schedule is one that we still need to receive and, if necessary, negotiate, and we will anxiously await receipt of that delivery schedule.
Merci. Thank you. Next question. Prochaine question.
Thank you. The next question is from David Thurton, CBC News. Line open.
Hello, ministers. I hope everyone is doing well. I wanted to ask about the situation that's happening in Brazil. Yesterday, we saw over 1,000 cases. The death toll is the second highest in the world, possibly set to overtake the U.S. And the variant of concern that was found there is, of course, at play. So I just wanted to know, what is the Canadian government doing first to protect, Canadians, and also help curb the situation there?
Well, so obviously, and we've said this since the beginning of the pandemic, it's a global pandemic. So as we've seen, if it's in Europe, if it's in North America, in South America, there have been at different moments over the last number of months, very difficult circumstances. And Brazil is an important country. It's a large country. It has a big population, and they have suffered a great deal. It has been difficult in Brazil in terms of the impact of COVID. That's why countries around the world, including Canada, have had to stand up measures at our borders. And Canada has some of the toughest border control measures of any country. We have, from the beginning, had this 14-day obligatory under federal law quarantine for anybody who comes into Canada. We have closed the borders for non-essential travelers. So we've stood up testing requirements before one would board a plane to come from Brazil or any other country to Canada. We've increased measures at the border around testing at the point of arrival. The quarantine measures have remained in place. There have been some, including the Conservative Party, who think we should be loosening these measures, who are asking questions all the time about why aren't we reducing or eliminating important measures that we've put in place based on the advice of doctors and scientists to protect Canadians. So we obviously share the concern of all Canadians about what's happening in Brazil, but there are also a number of countries around the world that are also facing difficult circumstances, and that's why it's important to keep in place all of the measures necessary to protect Canadians, and we'll continue to do so for as long as it takes to ensure that every possible safety measure is in place.
David, do you have a follow-up?
Yeah, but does Canada need to do more? Do we need to take stronger measures? Argentina, we're hearing, is closing its border. Do we need to adopt measures that not only protect Canadians, but also send a message to the Bolsonaro government that what is happening there, that treating this like the cold or a flu is not acceptable?
Well, obviously, the obligation for the government of Canada is to focus our energy on protecting Canadians, on protecting the health of Canadians, on providing the economic supports that are essential for Canadians and Canadian businesses to go through COVID-19 to support provinces and territories so they can provide the best possible health care necessary to protect Canadians in every part of our country. So our primary and most important focus is on what's necessary to protect Canadians. And the Government of Canada has responsibility for international borders. And that's why, as I said, we have put in place very restrictive, very effective measures based on the best medical and scientific advice we have. And we'll continue to improve those measures and leave them in place for as long as it takes to ensure the safety of Canadians. I don't think Canadians would find it particularly constructive for the Government of Canada to go around the world and point the finger at different countries of what they may have done or may not have done. Our focus is very much on what's necessary to protect Canadians. And obviously, like all other countries, we want this global pandemic to be brought under control and to be behind us in a global context as quickly as possible, because that's also in the safety interest and the health interest of Canadians to ensure that COVID-19 is under control and eliminated in every part of the country. But our focus has to be properly on what we need to do here in Canada to ensure the safety of Canadians, and that's exactly what we're focused on all the time.
Merci. Thank you. Operator, next question.
There are no further questions registered at this time. Il n'y a plus de questions à ce moment-ci.
Merci. Donc, étant à la fin des questions, ceci met fin à la conférence de presse d'aujourd'hui. Since we have answered all questions, this puts an end to today's press conference. Thank you.
Have a great weekend. Merci beaucoup. Au revoir, Anita.
Au revoir tout le monde. Merci beaucoup.